Are you getting a COVID vaccine this year, a flu vaccine, RSV? It is that time of year where healthcare professionals make a big push because we're going to be gathering with family over the holidays. So are you thinking about getting a vaccine? Or maybe you might have some issues about getting a vaccine. What are the risks involved if you don't get a vaccine for these infections? I'm Kurt Williams. Welcome to The Healthy Dude. We are joined by an expert today. We went straight to the top. We're joined by Michael Hooper here. He is Chief Medical and Academic Officer for Sentara Health. I have to stop right there. I mean, you are like straight to the top, right?
I work with a ton of people at Sentara.
Oh, yes!
I work with a ton of people at Sentara.
And he's modest, too.
They do all the hard work.
Okay. Let's see. So what this means is, it means a ton of things, but you have oversight of healthcare quality, medical staff affairs, academic affiliations, research ethics, and clinical education. Is that all on your business card?
Not quite. Not quite. I don't even know if I could say it as quickly as you did there.
But you know, your area of specialty as a pulmonologist treating patients of all types of pulmonary and respiratory diseases, including obstructive and restrictive lung diseases, respiratory failure, lung cancer, occupational lung disease, and more. And so that's why I say that we have an expert here on this topic. All right, so lots of chatter in the news, I don't know, over the past few years about vaccines, and unfortunately it's become political. How do you cut through all of the noise?
Yeah, I think when I look at it, there's a lot of chatter. There's a lot of loud voices on the extremes, but I think for the most part, there is a huge middle ground that people agree on, which is vaccines have been out there in our midst for an extremely long time. They're among the most effective public health measures that society has ever taken in terms of preventing disease, preserving life. And I think most of the discussion, if you really get down to it, is about that individual risk-benefit calculation. So who really needs to be getting the vaccine initially, who really needs to be getting the vaccine annually, and who really needs to be getting which vaccines. And that's what a lot of the debate has been about in the upper echelons of government. But
so does that mean that not everyone needs to get a COVID vaccine?
I think what it means is everyone,
or a flu vaccine, or RSV.
Yeah, I think there's a complexity there. I think what you can say for sure, take the COVID vaccine for instance, is if you've never had COVID and you've never had the COVID vaccine, you should get an initial COVID vaccine and you should get the series. I think the data on that is pretty good, and that minimizes your risk of getting the disease. If you get it, it lessens the risk of spreading it to others, which is really, really important for these types of diseases. I think with the COVID vaccine, do you need a booster every year, every person in the population? I think probably not. But
who would you say then should be? Like if they had when it was a big push in the pandemic, and I guess seems like it's been so long. Mm-hmm. There was a series of three maybe.
Yeah, there was a series of three, depending on. And there were multiple manufacturers out there.
So if you had that series of three, and then maybe along the way you still got COVID, would you right now say that person should run to their pharmacist and get a vaccine now?
I think at a very high level, what does it come down to? It comes down to you as an individual. If you were to get COVID again, does that carry a high risk of you getting really sick, possibly dying? Or are you in an occupation or a personal scenario where you're around a lot of people you could spread it to who would get really sick or potentially die? That's how I would think about it on an individual basis, is we want people to have up-to-date immunity against COVID if they are personally at risk or around people that are at risk.
Is that a point that you believe is often overlooked, that it's not just about whether you're in good health or whether you think you're not at risk, but whether, and not necessarily you work in a healthcare field,
Sure.
but maybe you've got family members who have a compromised
Yeah.
immune system.
I think that nuance has been very lost. I think it's very hard to get those types of messages out there, but at least personal, when I think about me, when I think about my parents, when I think about my children, that's how I try to make these decisions, is with vaccination against these very contagious illnesses, it is about your risk and about the risk of people you love and those people around you.
What do you say to the people who say, man, the pandemic's over?
Yeah, I think some of that urgency that we felt and we tried to communicate during the pandemic, when you couldn't go to the grocery store without a mask and people weren't having large gatherings and people were nervous about getting together for Christmas. I think it was very clear then that the societal need for us all to become immune so that we could get over that was very pressing. And so that's why there was so much messaging from the healthcare community and so much messaging for physicians to say, we need to all get out there and get immune to this. We know that there's minor risks to these vaccines. We know that there's things you have to think about at an individual level, but we know if we all just get this done, we can start to get back to normal. So that was then. I think now it's very different. It's COVID right now is much more of a seasonal illness like the flu. It poses real risks to certain people. The strains are changing, so there are reasons to still get that booster shot in certain scenarios. But we don't have that same pressing need where we need to line up everybody in the community and just give everyone a vaccine like we did back during the pandemic.
So what would you say, like right now, currently, what is like the real risk right now for either COVID or flu or RSV?
Yeah, I think the real risk to individuals is extremely personalized in those scenarios. So when you look at flu and COVID and RSV, these are very common respiratory illnesses that we see out in the community that we can spread to one another. But most of us who don't have significant health problems, have a normal working immune system, have very minimal risk at a personal level for those diseases. And so that's why there is a lot of messaging for all of those diseases. In certain scenarios, you need to go out and get vaccinated. And in certain other scenarios, you need to get vaccinated, or you should really strongly consider getting vaccinated, not just to benefit you, but to benefit everyone else.
So people are going to be gathering over the next few weeks, months for the holidays. Does that, even if you do think that you're generally healthy, does that kind of make a big push right now to consider vaccines?
I think it affects my decision, and when I give advice to other people, I think that's something you really strongly have to take into account. My grandmother's just turned 100.
Wow.
Yeah, I know. It's amazing, isn't it? So, but if I'm going to go be in close quarters all day with her on Christmas Eve or Christmas, she's doing okay. I don't want to change that by spreading flu into that environment. And so if, for me, it strongly affects the way I think about it.
All right. What I want to ask you next, we need to take a break, but what I want to ask you next is the timing. Okay, when do I have to get this vaccine, in order for it to really be in my system and effective? There's plenty of time for Christmas, but for Thanksgiving, the timing. And also, could you conceivably get all three? And so this is what's coming up right after this break. All right, welcome back to The Healthy Dude, joined by Dr. Michael Hooper, who is straight to the top of Sentara, Chief Medical and Academic Officer for Sentara Health. We were talking about, getting vaccines in time for them to be effective for the holidays, and also what's the difference between all three, and can you get all three? All right, so let's first start with if you're trying to time it out, what's your window?
Yeah. So if the vaccines all deliver either some piece of, or in historically a dead version of a virus or a part of the virus that doesn't quite work.
When people hear that,
yeah, I know.
that's when their heads go pink. Like, wait a minute, y'all put the dead virus in me? Yeah. What's up with that?
But it's important to talk about because people are going to read it on their own.
Yes.
And so, all the information's out there, so we might as well talk about it. I think historically we've tried to be very careful what we say, but people then read all this information from maybe an unreliable source. So let's just talk about it. But that's what we're doing is we're taking either a protein or a piece of the virus that we know is important in generating your immune response, or historically some dead version of the virus or a version of the virus that isn't going to make you sick, so that you can start making antibodies and your immune cells can start recognizing that virus. That takes a couple weeks for that immune response to form after you've been inoculated with the vaccine. And so ideally, if we could time this perfectly, if we could predict the peak flu season and the peak COVID season and the peak RSV season every year, we would march everybody out in about 3 weeks or 4 weeks ahead of it. We would give everyone the vaccine that day, but we can't quite do that. So what we recommend to people is when it gets to that time of year, when we know it's coming soon, then we want people to start getting vaccinated, because these vaccines last for 6, 8, 9 months in terms of that immune response.
So is the flu currently here?
The flu currently in our environment. Yeah. There's always some, but the levels are very low right now in terms of influenza and in terms of COVID-19 in our community right now. And so we don't have.
We always hear the newscaster say the flu season is here. It's time to roll up your sleeves.
Well, the historic flu season is getting here. It always kind of starts to come up over the holidays when it gets cold. Everyone goes inside. They're gathering for the holidays. They're breathing on one another, and that's when you start to see a lot of things spread.
So, I don't know, so 2 weeks, 3 weeks before the big gathering?
Yeah, I either that or it's fine now. I mean, because we don't want everybody.
I'm going to procrastinate because Well, I'm only going to get it when I absolutely think that I have to. So now,
right now is a great time to get you through the holidays and have a robust immune response, so that if you get exposed, your likelihood of developing the infection yourself, or if you do get a mild version of the infection, your likelihood of spreading it to others is much lower.
So when you consult with Dr. Google, which many of us do, and you try to look at the differences between, as far as the symptoms, how do you distinguish the impact of all three, RSV, COVID, and the flu?
So they're all respiratory viruses. They all, the predominant symptoms, not all the symptoms, but the predominant symptoms come from an inflammatory response in our lungs. And so you're going to get a lot of the same symptoms with this. You're going to get coughing. You're going to get maybe some difficulty breathing. You're going to get fever with all of these. And so just looking at your own symptoms, you're probably not going to know if you have flu or if you have COVID or if you have RSV.
Is the age group different for RSV?
So anyone can get it in terms of RSV, flu, or COVID. The risk age group for RSV is significantly different. And so where we see people get really sick with RSV is almost exclusively at the extremes of ages. So newborn babies or babies that are in that first year of life, or elderly population. People 75 or older have a much higher risk of developing a severe problem when they get RSV. But anyone can get it.
Yeah, but could you conceivably get all three at the same time?
Conceivably, yes. Would we figure it out if that happened to you? Maybe not. But conceivably, yes. But typically, no. I mean, typically these diseases are moving through our communities in waves, and they're not all going to spread at the same time, but definitely multiple can be spreading at the same time.
Is there one that is one to really worry about? Like, could you grade them as far as
Well, again, I think that
or does it depend on who you are and your age and your immune system?
If you just look at the numbers flu and COVID are dramatically more predominant than RSV. So we will see tens of thousands, maybe hundreds of thousands of RSV infections in the country on an annual basis, whereas bad flu season, we might see 40 million. And with a bad COVID season, the testing isn't as good now because people are less likely to get tested, but we're probably seeing numbers that approach that in terms of the millions of people.
Which one would you say it claims? I guess by the numbers, does the flu claim more lives?
They're similar on an annual basis in terms of when a physician fills out a death certificate. Is this due to flu or is this due to COVID? We're seeing similar types of numbers nationally in the tens of thousands of range, deaths due to influenza or deaths due to COVID-19.
Is there a way to break down numbers to see if you can get a handle of, out of those numbers, who died and they weren't vaccinated? I mean, is there a way to kind of extrapolate, like, what the numbers would be if, like, I don't know, a third of them or more got the vaccine?
There are probably researchers that could do that. In the public stats that are available, I can't tell who was vaccinated, who was not. I know that the vaccination rates for flu annually are not extremely high, so less than half the population gets a flu vaccine every year. We do have small studies that definitely show that if you got the flu vaccine and then got flu, you are less likely to be hospitalized, you're less likely to die, and you're definitely less likely to spread that to other people. So we can guesstimate based on those small studies, if everybody got the flu vaccine, we would probably save 5,000 to 10,000 lives per year across the country. And we're a big country. Yeah. So when you look at those numbers, that would be my guesstimate.
All right. We need to take a break, but coming up, I want to ask, what would you say to a vaccine skeptic? If you could have coffee, or if they're listening right now, what would you say to a vaccine skeptic? That is right after we take a quick break. All right, we're back on The Healthy Dude, continuing our conversation with Dr. Michael Hooper. And the question I posed before the break is, what would you, if you're having coffee, for someone who's listening right now, what would be your go-to argument if you could have a word with a vaccine skeptic?
Yeah. Well, I think the most important thing is what you were saying about having coffee with them. So, in all seriousness, I think the biggest problem that I see in our society right now is this chasm between professionals or experts and then the general community. We don't mix and mingle the way we used to, and there's a trust gap that's developed, which I think is a bigger problem than the logical A plus B equals C. I'm going to convince you of something. I think it's more, you can only be convinced of things if you identify with the person that's trying to convince you, and you believe them, you trust them. And so I think that the biggest thing I would do is just be authentic with them. Like I was talking about earlier, try to be very transparent. We're not hiding anything. Our motives are simply to help you. And then I would tell them whatever facts they wanted to know. And a real important thing that I say to people, which I think really matters, is this is what I did for my kids. This is what I told my parents to do. This is what I told my grandparents to do. This is what I did. And I think when you're speaking to the average person, that matters more than trying to pull some study out of the New England Journal of Medicine and wave it in their face, right? So I think the important thing is just being real with people, giving real world examples, and just being completely authentic and transparent. I think people want to believe that in order to change their mind, they need to believe that you are with them and you are trying to help them. I think that's the key.
Why do you think there was much more skepticism about the COVID vaccine than the flu vaccine? I mean, at least to me, it seems that there really wasn't this backlash. You know, I mean, we've been taking, I don't know how long we've been taking the flu vaccine, but for some time. And why the skepticism over the COVID vaccine?
I mean, I think COVID was just so disruptive to society that it was a focal point of everyone's thoughts, everyone's conversations for, I don't know what, a full year. That's just all anyone talked about or thought about. And these vaccines came about in 6 months, maybe 9 months, from we've never thought of this before to now we're gonna give it to you. We used novel technology to develop that, so technology that hadn't been used to make vaccines before. And because it was such a huge societal event, everyone's staring at that, everyone's thinking about that. And then I think...
Yeah, because I've talked to some people who were like on the fence, and you bring up, all right, well, are you okay with the flu vaccine? Yeah, man, you know, they've been working on that for some time, you know, but this COVID vaccine, they haven't had enough time to really see what the effect, and then also you hear, and you know, I'm not sure what studies have been done, but you do hear from some people who say, you know, ever since I got that COVID vaccine, you know, something's been all jacked up in my body.
Right. And you know, all I can say to people is, you know, again, let me go back to what I talked about earlier. I got it as soon as it was available to me. I lined up my kids, I gave it to them. I had everyone in my family get it. No material gain for me. I did that because I was sure that was the right thing to do for them, because I had read word for word, start to finish, every study that had been published in the scientific literature about that. I'd read everything I could read about the mRNA technology that they used to develop the vaccine. I gave lectures on it. So I was convinced that the right thing to do for my family and the right thing to do for our community was for us to get the vaccine and us to get out of this pandemic. And I think that is just an important message for us to deliver as healthcare providers to everyone else, is that the doctors were banging down my door. How do I get this vaccine? Because they knew that it was the right thing to do for them and their loved ones.
I am not a vaccine skeptic.
No.
However, when I look at everything that I'm eligible, like I'm old enough that I'm eligible for the shingles vaccine.
Yeah.
Now, I know some people who've gotten the shingles vaccine, and they say, man, you don't want that.
Yeah.
But so I'm thinking like, geez, RSV, COVID, flu, shingles? What do you say to people who are trying to figure out, do I want to space them out? Do I need all? I mean, I would imagine that that's also, people who aren't vaccine skeptics are like, do I want all of that in my body all at once?
Yeah. Classic example of where having a primary care provider with a good relationship, developing that trust and talking to them about it is a key, right? Because I think it is different if you just cross the age threshold where you can get those vaccines or you're eligible to get those vaccines, but you run 8 miles a day and you've never had an illness in your lifetime, you know, your risk from those diseases is probably very low. And so waiting a little bit, taking some time before you get them, spacing them out may be fine. Versus, you know, if you are in the midst of chemotherapy for the cancer that you're being treated for, and or you've got a loved one in that scenario, it may be much more important for you as soon as possible to get immunity to those diseases to protect yourself or the people that you love. And so I think that is where there is an individualized part to this. It's not always you got to do this at 55, you got to do this at 65. I think it's really important to have a relationship with a doctor or a healthcare provider and talk through this.
Don't be persuaded by the talking heads you see on TV.
Right.
I mean, talk to the person in front of you. You know, you're a healthcare provider.
Absolutely.
I know we're out of time, but I just want to ask one more question. For people, I'm going to do my own research. Now that's it would seem as a little trickier. Like, would you recommend someone go to the CDC website
Yeah.
now? I mean, or is it, I'm going to do my own homework, or is it better just to have that one-on-one conversation with your healthcare provider?
Yeah, I nothing replaces, I think, having a doctor or a healthcare provider you trust and talking with them about all the individual things that may influence your decision. And so I think that is something everyone should do, and I think that's incredibly important. People are going to do their own research. There's nothing wrong with getting more information.
But there's some scary things on the internet now.
There are some scary
and people
things.
Sometimes want to go to their own. It's an echo chamber. They want to
Right.
go to where. Let me go to where I know I'm going to hear what I want to hear.
Right, and that's the point I was going to make, is that if you're going to do your own research, do it broadly.
Yeah.
And I did go to the CDC website just before I came here, because I wanted to see what exactly is on there before we walk in here. But I would say even though there's so much controversy about some changes in the vaccine panel and the way they're making their decisions and some of the nuance in terms of what vaccine is being recommended for who, most of what's on that website now is still very reliable information. And even the controversial things, I think taking a big step back, they're minor changes versus what was there 6 months ago. And so I think most of those recommendations are still very solid and things that you can put your faith into.
All right.
Yeah.
Dr. Michael Hooper. Man, I really enjoyed this.
No, it was great.
Yeah.
Thanks for having me.
Yeah, thanks so much.
Yeah.
All right, and we thank you for watching The Healthy Dude.